Hello, my name is Molly Hammond. I'm the PA with Dr. Hurt, and today we will be discussing important preoperative information about total and partial knee replacements. Prior to your preoperative appointment with me, please make sure you have obtained medical clearance with Internal Med Solutions and a CT scan of your operative knee with Mako protocol. If this has not yet been completed, contact our office for assistance. At your medical clearance appointment, you will receive blood work, an EKG, nasal swab, and review your medical history. The internal medicine provider will instruct you on which medications to take and to hold before surgery. Remember, no eating or drinking after midnight the night before your surgery. To begin your preoperative visit, we will confirm the type of procedure, date, and location. The majority of our knee replacements are currently being performed at St. David Surgical Hospital on Lewis Henna Boulevard in Round Rock, Texas. The facility will contact you the day before your procedure to confirm your arrival time, which is typically about 2 hours before your scheduled time of surgery. Once you arrive at the hospital, you will get checked in and meet with an anesthesiologist who will perform a nerve block for your operative leg. This involves injecting a local anesthetic to numb the nerves of your operative leg. This does wonders for pain control and lasts approximately 12 to 18 hours after your surgery. You will then meet with Dr. Hurt, who will answer any last-minute questions that you have and mark your operative knee. Once in the operating room, you will sit on the operating table and receive a spinal anesthesia to numb the lower part of your body. But fear not, you will also receive medication in your IV to make you go to sleep. The duration of the procedure is usually less than an hour. However, the total process from receiving your spinal anesthetic to surgery to closure is closer to an hour and a half. For specifics about the procedure, please reference Dr. Hurt's video about robotic knee replacement surgery. For incisions, you will have one primary vertical incision down the front of your knee and two smaller 1 centimeter incisions below this on your tibia. The smaller incisions are for a tibial array, which looks like a mini satellite dish. This allows for communication between your knee and a computer monitor that has your CT scan on it. It is worth noting that due to the location of the primary vertical incision, there are some small sensory nerve branches that are cut to allow for exposure of the knee. As a result, you will likely have a small area of numbness over the lateral aspect of your knee after the surgery. This is common and may diminish over time. However, some decreased sensation may remain. This is not detrimental to your overall recovery process. Your knee will be closed in layers. All of the stitches will be underneath the skin. We will apply a thin mesh dressing directly over the top of the incision that is called Dermabond Prinea. This is sealed with skin glue and is water repellent, which means you can shower with the dressing uncovered. However, do not submerge your knee in any body of water, whether that be a bathtub or a hot tub, for risk of infection. You will leave the dressing in place until we see you for your first postoperative visit. If you have an adhesive allergy, please let me know at your preoperative visit so we can plan for an alternate dressing. After your surgery, we will apply white thigh-high compression stockings on both of your legs. The stockings are to be worn at all times except for showering until your postoperative visit. The stockings help decrease your risk of blood clots and help control swelling of your operative leg. We will also apply a knee immobilizer on your operative knee after surgery. The knee immobilizer is to be worn when you are up and ambulating for the first few days after surgery. It does not need to be worn when you are at rest or sleeping. Your home health physical therapist will help you wean from the knee brace as your quadriceps strengthens. You are able to weight bear as tolerated on your operative leg after the surgery, but we will start you with a rolling walker. If you do not have a rolling walker, home health will send orders for the walker, which will then be delivered either to the hospital or to your home. You do not need to bring the rolling walker into the hospital, however, have it accessible when you get home. In some instances, a drain will be inserted in your knee to prevent fluid from excessively filling your knee joint. The drain will be removed either when you are at the hospital or by your home health physical therapist. Once it is removed, a waterproof dressing will be applied over the drain site. In most instances, patients will spend one night in the hospital for observation and then will be discharged the following day by physical therapy and internal medicine. It is possible if you want to go home the same day, pending clearance from internal medicine and physical therapy. If you would like to discuss transitioning to a rehab facility after discharge, you will meet with a case manager during your hospital stay who will offer placement options based on your insurance. Prior to your preoperative visit, expect a phone call from Accent Home Health, formerly known as Texas Home Health. They like to provide a home assessment before surgery if possible. Accent Home Health will perform in-home physical therapy for 3 times a week for the first 2 weeks after your surgery, so that you do not have to worry about going anywhere initially for your physical therapy. After discharge from home health, we then recommend that you transition to outpatient physical therapy for approximately twice a week for 6 weeks. You are responsible for contacting and scheduling your outpatient physical therapy, but we are happy to offer recommendations. We will provide physical therapy orders at your preoperative visit. Our goal for you is that you have full extension and 90 degrees of flexion by your first postoperative visit. Remember, you will not damage anything by moving your knee. Scar tissue likes to set in at around week 6, so work hard on getting your range of motion back to decrease stiffness. Full range of motion after a knee replacement is full extension to approximately 130 degrees of flexion. As far as recovery goes, the first 2 weeks are the hardest because that is when your knee is the most swollen and inflamed. At their 2-week postoperative visit, most patients are still using a walker or a cane, but by 6 weeks are walking independently. Every patient is different, but it usually takes approximately 6 to 8 weeks until people feel comfortable standing on their feet for prolonged periods of time. For postoperative swelling, our office offers a great cold therapy product, which helps greatly decrease your postoperative swelling and lessens use of narcotics. If you are interested in this cold therapy product, we can discuss this further at your preoperative visit. It is a cash pay item of $250. We also recommend that you elevate your operative leg above heart level, and you can ice for 20 minutes by the hour, but do not apply ice directly to the skin. At your preoperative visit, you will also sign a risks and complications form, as well as a proof of purchase or advanced beneficiary notice acknowledging a $400 Mako robotic fee. This fee is not covered by insurance, and we will collect the fee at the time of your preoperative visit. Part of this fee includes the preoperative planning that Dr. Hurt performs to analyze your CT scan and plan the most individualized implant size and positioning for you. We will then use this plan during your surgery. We will prescribe your postoperative prescriptions at the time of your preoperative visit. We will then send in the prescriptions electronically to your pharmacy on file. We will send in a pain prescription as well as a prescription for anti-nausea. For pain, we typically prescribe Norco, which is hydrocodone and acetaminophen. We also recommend that you take NSAIDs in conjunction with the Norco, like ibuprofen and Aleve, as long as you do not have contraindications to NSAIDs. NSAIDs can help greatly reduce your pain and overall inflammation, as well as help you transition off of the narcotic. Please follow standard dosing guidelines for the anti-inflammatories. It is important that you do not take narcotics while driving. For additional information about resuming driving after a knee replacement, please reference our postoperative instructions that I will provide to you at your preoperative visit. Common side effects of pain medication include nausea, itching, and constipation. For constipation, we recommend that you take a stool softener like Colace, which can be purchased over the counter. However, the best way to combat constipation is by discontinuing use of the narcotics as quickly as possible. For blood clot prevention, we instruct you to take a baby aspirin, 81 milligrams, once in the morning and once at night for 3 weeks after your surgery. This will be started immediately after your surgery. At your preoperative appointment, you will receive a blue folder, which looks like this, which contains your postoperative instructions, physical therapy orders, handicap prescription, and facility information. We've discussed most of the contents of that folder, but a few things I want to point out to you. For your signed handicap prescription, you will take that to your local county tax office if you want the placard. This is valid for 90 days. Also, at the top of your postoperative instructions, there is a number for you to call for an after-hours answering service called MedLink. In the event that you need us after hours, just call that number and either Dr. Hurt or myself will return your phone call, so someone's always accessible to you. At the end of your postoperative visit, we will make sure that you have a follow-up appointment scheduled with us for 10 to 14 days after your surgery. And then for our Marble Falls patients, we can do all your postoperative follow-up in Marble Falls at the next care. Lastly, this is a life-changing procedure. You are in great hands with Dr. Hurt. If you have any other questions or concerns, feel free to contact me. Otherwise, I look forward to seeing you at your preoperative visit. Thanks and have a great day.